We all know this time of year is a busy one. There are the holiday parties, the pressure of family time, and of course that often means going overboard with food, alcohol, presents, and those late-night parties. But we don't usually think about what that means to our health. Global Nationals health specialist Dr. Zentner joins us to talk about why this time of year is the worst time for heart attacks. What's the rate?
So it's an interesting study that was first come to light in Circulation in 2004, showed that in December and January, dramatically higher rates of cardiovascular disease deaths, so heart attacks and strokes around this time of the year. This has actually precipitated throughout the last decade, and in fact, 2012 data on the Canadian Death Survey shows that there's a 10% increase in heart disease, heart attacks and strokes, and deaths from heart attacks and strokes in December and January.
But the reason for this is twofold. One is the diet aspect of it, the stress of, family, etc., and the other is activity levels.
Absolutely. I think, remember that this is a time of year where people are definitely doing things that they might not otherwise do. So from an environmental perspective, this is a time of year where we tend to indulge. We have a higher rate of exposure, so to speak, to sugar, fat, salt, and alcohol. This is not for healthy people. So we're not talking about the effects on, let's say, a 25-year-old here. We're talking about a population that are already at risk. And so this kind of exposure to this sort of indulgence can often have adverse events. And then on the activity side, you have a population that isn't otherwise active, maybe shoveling snow, doing a lot more running around. And then finally, the added stress of, for example, emotional stress, financial pressures, time spent with family, sort of environmental stressors that people have at this time of year that they might not otherwise have, and that they tend to be more vulnerable towards.
Sometimes it's easier said than done, but what can you do to minimize all this?
I think the key here, and we talk about this a lot, is having a healthier holiday. And so I always encourage families to start new, healthier traditions. Indulge a little bit less. We're always talking about having less stress around the holidays, moderating alcohol consumption. And then I think that the biggest issue that I want patients to take home is if you start having symptoms around the holidays, whether you do have a history of disease or not, seek medical attention. Don't wait for the holidays to pass before you get medical help.
All right. Thanks very much, Dr. Ali.
Thank you.